Yeah.
You know, it's interesting. We always put this emphasis on intentional introduction by some enemy, but the chances of this being introduced by either natural transmission or just people inadvertently crossing international borders, I think is even a more likely possibility. And I think your most cogent point was that if you have a strong and effective public health system, which in a way, this whole healthcare reform stuff really should bring about in this country. I mean, it shouldn't only be about insurance, it should be about the system itself. That really, that is our best defense, not thinking that Al-Qaeda somewhere is trying to brew up some way of introducing it. I think if it happens, it will happen anytime. I mean, it was like the Medfly thing. We don't know that it was ecological terrorists. I lived in Los Angeles at that time. Right. And nobody knew what was going on. They just thought, I think most people felt that it was a natural phenomenon rather than a terrorist incident.
Yeah, I think in that case, right. I mean, I would lean to the idea that it was probably the exploitation of a natural event by bioterrorists, right? So they probably weren't responsible, may not have been responsible for the initial introductions, but then once you get your hands on some of the medflies, they're relatively easy to then produce. So it may have actually been both, a combination, but your point is extremely well made, and I guess, I mean, one of the worrisome things is that these sort of infrastructural costs, going back to this gentleman's question, right, are very hard to sell to the American public because they're non-heroic, right? All we're doing is preventing. In a sense, if what it takes to motivate or catalyze the development of a good agricultural pest management infrastructure and a strong public health infrastructure is the possibility, and I think it's a real possibility of a terrorist attack, then that's what it's going to take because we have an affinity for that. But you're right. I mean, a lot of people in the medical entomological community don't use the phrase if Rift Valley fever arrives. They use the phrase when Rift Valley fever arrives, right? And a lot of these insect pests and a lot of these diseases, given globalization, are becoming more and more whens, not ifs. Now, the bioterrorist could make things happen much faster in ways that are much more difficult to control. They could do things that aren't going to happen naturally. For instance, the National Academy of Sciences did a special examination of biological terrorism. And one of the things that really concerned them was the reintroduction of screwworm fly. So we've eradicated the screwworm from the United States. Very few people in the livestock industry probably even remember screwworm. But it was a devastating insect pest costing tremendous amounts of money. We have an eradication program that's pushed it down into Central America. But the National Academy of Sciences has this report, and it's interesting. It's somewhere between classified and not publicly available, so you can actually get it, but you have to come up with a story while you need it. And in there they describe a scenario in which, for just a few $1,000s, a bioterrorist could reintroduce screwworm fly from Florida to California across the southern United States at a cost of about $10,000. So it is on the radar at that level. It's certainly on the radar of the National Academy of Sciences in the bioterrorism unit or research program at George Mason, but it's not sort of risen onto the radar of Homeland Security. And we don't link, we tend not to link all the discussions we're having about healthcare system with questions about national security. And I think the two, in a very real way, could be thought of as a package deal, not a fragmented sort of approach that we're taking. If there's maybe one more question or not, yeah, in the back, and then we should probably take a break.
I particularly like this discussion about the public health system being a good first responder kind of thing. Just sort of doing a little bit of free association here, would I be right in suggesting that the people who really handled the problem of infection from outside the country really well is actually the agricultural community. We've had barriers against mad cow disease coming from Britain. California certainly has ways of trying to keep various pests and things out of California. Are they ahead of the public health area on this? And could the public health area learn something from how the agricultural community is worried about, brucellosis and, all of this kind of thing?
I think there is. I mean, in some ways, I think in some small ways, we're ahead in agriculture, given that we've recognized, I think, in agriculture, the economically devastating effects of non-native species, right? And in the public health community, we've not sort of had the same. As a matter of fact, what we've been doing in this country is sort of systematically eliminating diseases, right? And it's only been relatively recently that we've had diseases arrive. Lyme disease, right, was sort of an early classic tick-borne disease that got people pretty excited. Then we've got West Nile virus. We're worried about flu, right, H1N1, because that's going to come from outside our borders. It comes from outside everybody's borders, I guess, except Mexico, supposedly. So, yeah, I think there is sort of a. I don't know if the infrastructure is much more sophisticated, but I think the level of awareness is higher in agriculture, simply because the vast majority, the overwhelming majority of insect pests in this country are non-natives, right? So we're already attuned to this. But if you look at agriculture's ability to actually engage in early detection and response, there are some success stories with, for instance, it looks like it's now out of control, but we took some early action against the Asian gypsy moth. The emerald ash borer now is a pest that we probably missed for more than 10 years, and we're looking at hundreds or at least tens of millions of dollars in damage around the Great Lakes from that pest. So we've caught a few, we've missed a few. The successes, and again, I mean, that's really tough for agriculture, right? So if some poor sap, USDA APHIS inspection officer, right, nabs a foreign pest out of somebody's luggage, right? Well, that's kind of like prevention, right? So what they prevented possibly is this tremendous loss. That's not heroic, but if we can fly, airplanes over an incipient infestation and sort of blanket it in sort of an emergency way, to quash an incipient outbreak of an exotic pest, that gets a lot of press. And so if you look back at the literature, the number of what they call interventions, the number of times that USDA inspection officers remove or detect incoming new pests is absolutely phenomenal. The fact that we're not overrun with these things is the remarkable part. But then, of course, even if they get past inspection, a fair number of them, never reach outbreak levels. But yeah, I do think that at least historically and sort of conceptually and institutionally, agriculture is more attuned to the threats of new pests than perhaps the medical infrastructure has been attuned to the arrival of new diseases. I mean, look at the CDC during West Nile virus outbreak. Their early inability to diagnose that, right? And then the battle that woman, the doctor in New York, had a fight against the CDC, and basically she ended up drawing in what was left of the military infrastructure at Fort Detrick, right, to nail that down as a new virus and not an existing like St. Louis encephalitis. And so we bungled that for a period of weeks in terms of our medical infrastructure, and by the time we had identified it, it was almost certain that the disease was not going to be under control. So yeah, we despite the CDC's slogan of prepare for, expect the unexpected, that's exactly what they failed to do in that case. Okay, well, I think we've reached, we're supposed to quit, right? And I think there's coffee and some announcements.